Welcome to The Better Life with Dr. Mariane Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mariane Pinkston.
Hello, everybody. Good morning. I am Dr. Mariane Pinkston, and welcome to The Better Life with Dr. Pinkston. I have, this is San Antonio radio here locally, but I also podcast out to YouTube and iTunes, Spotify, iHeartRadio, and all of the platforms for podcasting. So please check us out. You can go to my website at drpbetterlife.com and find all those places. And I have been doing this for over a year now. I've had a ton of guests, and I have a repeat guest on this morning because of his popularity with all the information that he gives, and he has been doing some wonderful things. So, Mr. Kyle Sinclair is with me this morning. He is with Warm Springs as their Chief Executive Officer. Has been there, I think, for almost 15 years or so. Is that right?
Overall experience over 15, yeah.
Well, he's got a lot of healthcare experience, so we wanted to talk a little bit about healthcare this morning. Also got his master's at Ohio University, and he has been doing this for a long time. So in talking about healthcare, I know Open Enrollment is coming up, right? And you know, you have, I think, stepped down for just a few months now as working with the Warm Springs, because you are also running for Congress in District 20. Is this not right?
It is. You know, I keep saying that the best people to fix healthcare are those within the industry.
Absolutely.
And we can't fix it unless we have true representation and somebody who understands our industry.
Right.
That can fight for physicians. And so, yeah, I mean, I'm excited. But yeah, open enrollment's it's a hot topic. It's coming fast. It's a big issue across this country.
Yes,
and,
it is.
You see what happens to the seniors, particularly. They're a big focal point for insurance companies right now.
Right.
So,
well, they do a lot of Medicare Advantage programs, which bothers me. On one end, I know it's very affordable for people, but I know the insurance industry takes that Medicare money, kind of throws it in a pile, and then divvies out a little bit to whoever needs it. But you know, I have not, as a physician, you know, I'm a primary care physician. I own my own business. I'm one of the dinosaurs out there as a provider and owning my own business, not working for a big corporation. But I know as when you sign up for these Medicare Advantage, at the end of the month, the year, you know, they take what's left over of the pile of money and, you know, give it to the insurance, give it to some of the doctors. And I've been kicked off, I will happily admit, I think I'm proud of this. I've been kicked off of a few because I spend too much money.
Yeah.
I take care of my people, and I spend the money I feel like that needs to be spent on them instead of pocketing it at the end of the year.
Well, and that's unfortunate. What seniors don't realize is that when they give up their Medicare benefits to a Medicare Advantage plan, they don't understand what they give up.
Exactly.
They're promised, pharmacy, drug costs. They're promised a couple of other things, but they don't realize everything they give up.
Right.
And on the operating side of it, I mean, the Medicare benefit is still the best benefit and insurance in this country. I mean, I have two parents. My mom retired. My dad's retiring in January, and I told them both, stick with Medicare.
Right.
Do not go to Medicare Advantage. I don't care what
Get a supplement if you need.
Absolutely.
Get a supplement. It's a little bit more expensive. Oh, but you get way more with what you do.
And the reality is, the insurance doesn't stop you or tell you can't do a test, you can't go here, you can't see this physician.
Exactly.
So,
can't have this medicine, you can't,
you as a patient own your health care and can work closely with the physicians that you've been seeing for years and years and years. So yeah, I mean, it's a tough one. And unfortunately, our general population as a whole are very uneducated on health care. And rightfully so. I mean, I have a bachelor's and master's, and I said this on the show last time, bachelor's and master's health administration, almost 20 years experience, and I still don't understand our healthcare system.
It's so true.
And you don't expect a lay member of society who's never been involved to understand the ins and outs of our industry, and most people don't.
Yeah, and they absolutely do. And I know it's difficult too, because we were talking for a few minutes beforehand about some of the self-employed, small business. I think that, you go to a large corporation, you work for somebody, you get these great benefits, you're set. You work for somebody like me. I'm a small business. My trainer, Sonia, who I mentioned beforehand, small business, she is uninsured. I'm the only one insured, and my business is the only thing I can afford. So is there anything that small businesses can do at this point?
No, and unfortunately there's not. lot. And I'll tell you, you mentioned about running for Congress. That is something I want to work on, is the Small Business Healthcare Reform Act. And that's to allow small businesses to be able to offer insurance for their employees, because right now it's too expensive.
It is way too expensive.
And you look at even a large corporation, you have the employers are the largest expense of labor, and then it's your benefits. Right. And so even for large companies, the amount of money they spend on the insurance premiums, and you're seeing a lot of companies now shifting that to the employees.
Exactly. They'll pay half, and then the employee pays the other half, and it's still very expensive.
It's very expensive. I'm doing. I think I shared this in the show last year. My son had a shoulder surgery, and I'm still fighting the insurance right now. Still fighting the hospital personally, and let it go into collections on purpose. I don't recommend this to anybody. This is what I'm doing. Because they'll take pennies on the dollar once it's into collections. And the reality is that we have to fight for our benefits. We have to fight for our rights. And so back to the small business, I would love to be able to propose that bill and work closely with small insurances. That's the number one employer of this country, are small businesses. They were impacted by COVID, and we need to fix it and help them out right now.
Absolutely.
And again, the healthcare industry needs to get together. We need people to be able to work closely, and up at government to be able to pass this along. So that we can provide insurance to our country and not push towards a socialism, big government. I'm not for that. But let's work together. We can find solutions. We're a great country. We've got brilliant physicians. We've got great minds that are in this country. And so I think we could do some good.
I think it would be wonderful. I would love it at some point, if I ever could, to speak to something like that, because of just the experience I've had over 25 years of actually not being hired by a big corporation. So I've been offered, you can't even believe the amount of money that I've been offered by Concentra or Humana or Methodist or somebody to be bought out and my practice taking over. But I have fought that tooth and nail. I would be retired, a very rich woman by now if I'd done that, and I'm exactly the opposite. I know everybody, thinks the doctor has so much money, and that is absolutely, when you run your own business as a physician, you do not have money. And, 2 kids in college and all, but that experience that I have to be able to speak to where I see the problems now and what could be fixed, I think would be invaluable, because once you I hate to say it because I don't feel like physicians always have to do this, but once you kind of sell out and go into the big system, you really cease to understand as much about where the system is broken as somebody like me who has really faced it and worked through it since 1997. It's crazy.
Yeah, and it's tough. And as we were sharing before the show started, that the industry of solo practice is dying in America. And has been for a couple of decades.
So sad.
And it is extremely sad. You lose a lot of independence. You lose a lot of credibility of individual physician groups and the impact that they have on the local community. And so there's some significant issues in regards to solo practices in America. And San Antonio is no different than the country and what we're seeing. So my hat's off to you. You've lasted this long. I know a handful of physicians in San Antonio have been doing it 40 plus years, solo practice physicians, and they have tens of thousands of patients. And as I was sharing with you earlier, the healthcare is a business, and most people don't realize it. It's a business. And I don't care what industry, what part of healthcare, it's a business. And you do want it in some regards to be a business, to be competitive and to push that drive. But the other end, you got to realize that it also impacts these small-owned local business, particularly on the physician side, because it's a low revenue, high volume type of business. And most physicians, see 20, sometimes 40, depending on how busy they are and how aggressive they can be, but at the average time of 3 to 5 minutes, maybe 8. Yours is a little bit different, but...
I do. It's very different. I still stick with the old way of really spending time and listening to people.
And that's tough.
It's hard to do.
But it is very hard to do. And it impacts your revenue, it impacts your business, it impacts the amount of cost that you have coming into you and your overhead. So we've got to fix it, and the best way to do it, again, is to have people in the industry.
So I know that you had an event on Tuesday of last week talking about healthcare costs. What types of things were brought up and discussed? Yeah,
and I think for me it was let's truly make this work and let's bring healthcare people together. So I partnered with a group called Texas Public Policy Foundation, which is the largest think tank in the nation and obviously the largest in the state of Texas. And that's exactly what it was, is healthcare reform by talking talking about healthcare experts. So we have a panel of a couple physicians, a professor at the University of Cardinal Word, myself, and that's exactly what we're talking about is that healthcare reform and how we fix it. And part of it's price transparency, part of it's fixing some of the issues that we're talking about right now, and how do we improve our healthcare system. And I've said it from day one, we have the best and the worst healthcare system in the world.
Well said. Well said.
And we've got to fix it. And it doesn't matter who you are, what type of race or political affiliation or where you live. You will touch healthcare, born into this world, you touch it all through your life, and you leave this world touching healthcare.
That's right.
And it's a massive part of our life that we've got to understand and we've got to be able to fix. So those are some of the things that we were talking about and being able to share and bring light and have some open dialogue across this country. So
I can't wait to see the final results of all that. I think it's going to be wonderful. And so I know people can reach out and look up some of your information. They can go to Kyle, KYLEFOR 20, so Kyle for 20, to look up some information on you. I know you're on Facebook and Instagram, and I know that people can look up information through Warm Springs. I know Warm Springs, Thousand Oaks, I think is the exact area you are, but you are going to have probably a lot more events coming up too. I know. Tell me about some of the events that are moving forward from here.
Yeah, I mean, there's tons of events, and I think we're excited to continue to talk to constituents across the city, and healthcare has been a hot topic.
Yeah, it really has.
And everybody understands. And look, and I shared with you before the show too, with the economy the way it is, which is the worst economy in my lifetime, worst economy in 50 years, we have the highest inflation rate, we're pushing recession and now depression, and everybody's dollars working less for them, the 401k savings are being wiped out.
Right.
People don't realize that the health insurance premiums also went up 25%.
Right.
And so, again, we've got to continue to address these issues. And that's the biggest thing is getting out, getting vocal, speaking about it, understanding, being aware of your decision, especially coming here in a few days when open enrollment hits.
Right.
And so there's a lot of different ways that people can do that. That is through social media. There's a lot. I'm all over social media, TikTok to Facebook to you name it. Social media is a great platform. Coming on and speaking with, great podcasts like yourself and learning and understanding. But that's it. If you want to get involved and understand that there are issues, there's many platforms that you can get involved and help and become educated and start asking those questions that are tough. And these podcasts like yourself are a great way to learn and be educated. So
it's tough. There's so many different things we could talk about, so many different points on healthcare, and I keep driving back to the cost of it, mainly because that's what people face first up. Now, once they even buy their premium and pay for their premium, the costs that go behind it even after that are extra on top. So I know from personal experience, I pay almost $1,000 a month just for me on an HMO, a good HMO plan, and still on top of that, I have to wind up paying for a lot of my prescriptions. I have a huge deductible to meet, even though I'm paying this huge premium, and so I know other people out there are experiencing the same thing. So the cost, you said, rising 25%. That was based on premiums, but also on the cost of meds and testing and everything else. I had to raise some of my prices in house. I haven't done that in 5 years. I have not raised my private pay fee or any of the other ancillary type of things that I do procedure wise or whatnot. I haven't done that in years and had to go up on that this year due to inflation. So yes, you were right. Also on the point of the business side of medicine as a physician, I have to maintain. I did not make very much money last year. COVID almost wiped me out. I did survive it. I have, like I said, 2 kids in college. I've got to buy cars for these guys, things like that. The cost side of it is absolutely swallowing not only me but my patients and everybody else.
It is, and that trickle-down effect of bad economy and bad economics impacts everybody in every aspect of your life, from cost of goods to obviously gasoline in your cars to pushing into the healthcare sector on the business side and taxes and it's just continuing to go up and up and up.
Right.
And that's where I keep sharing that we've got to be fiscally conservative as a country.
Right.
The biggest thing for me is we're a broke nation. We're broke. This country's in debt. We're 33.
Just say absolutely.
We are
please.
$33 trillion
Right.
in debt as a country, and we continue to spend.
Right.
And it's the same way as a business or as a personal banking
Sure.
account. If I don't have the money, we don't
Right.
continue to spend. We don't borrow.
But you've got credit cards, and you can get a
that works
loan,
out-
and you
that
can
works out
refinance
great.
your house, and you can do all these things.
Massive
and
amount
sure.
of interest, and the debt collectors come calling. Yeah, I mean, so I think from
doesn't
a
work that
country
way.
standpoint, we've got to fix that.
Right.
From a business standpoint, we've got to tighten our belts, and from the health care side of it, we've got to tighten our belts too. And I don't think cuts is the answer to healthcare.
Just be smart. I don't think we have to ration. I don't have to use words like ration and cut. I think it's just a matter of being smart about where it goes and how it fundamentally starts. It just seems so simple to me, but
Yeah, and healthcare, again, is a tough subject. I keep sharing with everybody that we're an uneducated society when it comes to healthcare. And I'll give you an example, right? I mean, you have and I've shared this before, but you get a sprained ankle, and we tend to go to the ER. That's the most expensive setting in healthcare, period.
It sure
Period.
is.
I don't care what it is. ICU may be a little bit more, but on an average general patient, the ER is the most expensive place, and our society uses that. The other thing is interesting about health insurance, and I've shared this before, is that for car insurance, we don't use car insurance to change our tires, to wiper fluid, or any of that stuff. We use it for one thing and one thing only: catastrophic emergency. When you get in an accident, that's when the insurance kicks in.
Right.
On the health insurance side, we need to use it just the same. And so some of that burden of cost will come to us, but we will also very clearly realize I'm not going to go to the ER every sniff or cut or bruise.
Right. So true. So true.
I'm going to go to my primary care physician, or I'm
Right.
going to go to a clinic, which is the cheaper of the cost setting. I'm going to get what I need here, and if they can't fix it, we elevate it up.
That's a great point. I want to expand on that just a bit, because patients think that, well, I'll go to the ER, they'll do everything, work me up completely, I'll know what's going on, I'll get cured or taken care of, and really that's not the case. You go to the ER to make sure you're not dying, put a little Band-Aid on it, then you go back to your primary care. I'm the one who figures out what's going on and tries to take care of all. When you go to the ER, it's easily a $500 cost or more, and when you come to me, generally it's about $150. That is a distinct difference in cost, and so I think people need to understand that. I'm glad you bring that up again, because it's really
and there
important.
could be a lot of education series, right? A massive amount of billboards or a type of radio ads or even type of social media blitz or blast in regards to which setting, right? And it's tough, people, to understand that. But the reality is that the hospital's set to do an average length of stay of 3 to 5 days. Their job, number one job, is to stabilize you
and then
move
boost
you
out.
on.
Exactly.
Right? Because it's expensive.
It is.
And we want health insurance to pay for all that. Again, I'm not a proponent for massive health insurance. I know there's issues on that front too, but we've got to, as a society, fix that problem.
We do have to fix that problem. So, well, we have talked ourselves into 17 minutes already. I can't believe how fast it goes. We are going to take a very short break and come back on the other side and talk more. Thank you.
Fatty liver is linked to two different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back, everybody, to The Better Life with Dr. Pinkston. I'm Dr. Mariane Pinkston, in with Kyle Sinclair this morning, who has an immense amount of healthcare experience in his background, over 15 years, been working with Warm Springs as their chief executive officer, now running for Congress. And we've been talking a little bit about healthcare costs and all the issues with healthcare we can pack into 26 minutes. So we got another 7 to go, or 6 or 7 here. So you and I over the break were talking a little bit about concierge services, which a lot of, so I'm a dinosaur, I admit it. I am one of the few true privately owned business family practitioners in town. And I have flirted with working with concierge services. My patients were not able to do that, so I backed out and went back into the insurance industry, taking insurance, and I went ahead and bid it on that one. It's very difficult because I would have done a lot better on the other side. So what do docs do when they do that? What is that all about?
Yeah, I mean, that's a tough one, though. I'll tell you from the insurance standpoint, I mean, you're getting hit with audits and recoups and the amount of money you're having to spend on the admin side just to process claims, to follow through. And I mean, so it's a business, and people don't realize it. They realize that when I go see a physician, they're just there to take care of me.
Right. No.
And there's so much behind the scenes and what goes on to running a practice or a hospital or a facility from that standpoint. But, concierge services is a great option. I mean, there's a growing industry of that. It's not really boomed in San Antonio, but in the nation it's growing, where physicians go basically private practice and they take cash only. And there's multiple ways of, you can pay a monthly fee and you can see you as much as you want.
Right.
Or you'll have some that, pay as you go, and it's a cash-based system. And so it's better for the physicians, better for the patients. There's no middle insurance. There's no co-pays, deductibles. There's no surprise bills or mail letters. Later on. So there's an industry for it.
And people can still use their insurance too.
Absolutely.
Because that's how they pay for laboratory, or if they have to get an MRI or go to an ER or be in the hospital, their insurance still kicks in. But then when they pay privately on the other side, they don't have to, deal with all those headaches and extra costs, and neither do I, which is really nice. But you're right, San Antonio has not caught on with that. I've tried 10 years ago, tried 5 years ago, and this town's a little bit different economically. I've always loved San Antonio. It is much more of a small town. It's not a huge, industry type of, it is industry, but it's most of the people work more blue collar in the industry rather than own the industry, So I love San Antonio for that, but it's made it very difficult for San Antonians to do something as lovely as concierge or that type of healthcare. Yeah,
and you saw even with COVID was tough on the healthcare industry.
Oh gosh, yes.
As a whole. So, I mean,
there
it
were
was
days I saw 2 people a day.
Exactly.
As opposed to the 20-25 that I see a day.
So, I mean, you fall in the small business category, and small businesses, it wreaked havoc. COVID wreaked havoc on the business. You saw them going under. They couldn't provide. They couldn't stand. And so healthcare industry, particularly the small business side, was a massive impact. You saw it on the hospital side where people were waiting to come in.
Exactly.
And so they were crazy sick, and there's a lot of issues going on with them. And so length of stay was still a topic, and physician coverage. But, it was amazing to see what happened when we went through COVID and seeing how it progressed and didn't progress, and seeing government's involvement, and both from the national and state level and city level. This is one of the reasons why I ran for healthcare.
Right.
The impact that a governmental agency has on healthcare was a big issue for me.
Absolutely.
So.
And down here in San Antonio, it's just probably too big of a subject to get into, really, but I have to bring it up, is we're so close to the border. Yeah. So what that has done to our healthcare system as well, taking on the influx of people that are here, they're sick, they've got to be taken care of. And my dad always said something that I was really young, so I didn't understand it until now, but he always said, healthcare is considered by people to be a right.
Yeah.
And it's not really, because it costs money, and it costs the system, and it costs the society. So anyway, that I know that's too huge for us to even
it is,
but
but I mean, so San Antonio is averaging about 1,000 immigrants every single day, every day, and they've got to be cared for.
Yeah.
And again, it's a cost to the Texas and city taxpayers. Right. I mean, so we've got to be able to provide for them. And then we have just immense population of unfunded here in San Antonio that also need resources and help. And you have small businesses that are struggling.
Yes.
You have physicians. So, and you got, for-profit companies and non-for-profit companies that are struggling just the same. So
Right.
we're in a unique spot as a
Aren't we?
country and as a society for healthcare. And
Right.
but I tell you, at the end of the day, I still love what I do. I still love talking to you. I still love healthcare. It's a passion.
Yes, it
It's
is.
a calling of mine.
Yes, it is.
I didn't get into healthcare to become rich or ultra wealthy. No, I get in because of what my love for it.
Same.
Right. My wife's a nurse practitioner.
Yes.
My mom was a nurse for 30 plus years, and so it's a calling and a passion of mine.
Absolutely.
And we need good leaders and people are willing to step up and say we need to fix this industry.
Absolutely. Well, I am glad you are doing that and out there. I'm forever thankful for that. And so just a little bit of information so you'll know where to find me, where to find Mr. Sinclair. You can go to drpbetterlife.com. I'm going to have all of his information. Actually, it's already there, but I'm going to highlight it again, where you can find Kyle Sinclair, and you can go to Kyle 420, which is Kyle FOR 20 for District 20. I think where most of everybody in the in the listening area is at, but you can definitely find more information. Also social media all over. And so I am so happy, absolutely happy to have had you on this morning. Thank you again
Thank you.
for coming on. I think you're doing a wonderful thing, whether you are running or whether you're not, and you're just working through the healthcare industry. Very smart, very passionate, and so thank you very much.
Thank you.
Anything you want to add on to the end?
No, I mean,
places to
I'll
find
share.
you, or-
One of the neatest things is working with Warm Springs as a rehab hospital. There's only one industry that you'll get that one-on-one
Right.
rehab, and it was amazing to see what COVID did to patients and long COVID, which is a subject we've talked off and on about, but
Yes.
the need for patients to be able to rehab, to get better, and to get back to becoming a productive member of society. And I think
Right.
everybody wants to go home. Nobody wants to be in a hospital.
Nobody wants to do that.
That's always my last words of parting when I talk to my patients is, I love seeing you, but I hope I never see you again.
There you go.
Right?
Yes,
So,
that's. I think every physician and everybody in healthcare should say just that. I love you, but go on, be healthy. So, and the same for you out there. Thank you very much. Visit DRP. Well, I don't even know my own website. So drpbetterlife.com. And everybody have a wonderful week. Thank you.